Hey everyone, this is Shonali Burke with Waxing and Lyrical, and I am talking today with Alex Talbott, who has been helping the UK's National Health Service get its social media efforts off the ground. Alex, thanks so much for taking the time to chat with me.
Thanks very much for having me. I appreciate it.
It's nice to actually talk after all of the Twitter interactions.
Indeed, yeah.
So we first heard about you through a wonderful guest post that Bryce Keane did a few months ago on the NHS's social media efforts, and it looked pretty amazing. So tell me what's been happening since then.
Well, we've actually managed to grow NHSM, which is fantastic. We have a core audience now who are joining every Monday at 12 and really getting involved in some good solid topics. The last couple have been looking at partnerships with other departments in IT, and that growth is now being taken on by a couple of other people as I've taken a step back as my NHS graduate scheme evolves. And those two people are somebody from the Department of Health, a guy called Tim Lloyd, and another guy called Colin Wren, who works for a hospital in London. So these two people have really good perspectives, policy, top-end stuff, and real day-to-day gritty NHS stuff. And they're taking it forward and growing it. And the next stage is that we take it offline, so we can get people together in a pub with a beer, just a nice informal chat. NHS communicators are already used to using and interested in using social media for their day-to-day jobs. Start discussing how they can better use it and influence some of the directors that they report to. And then also in the new year, we're hoping to actually integrate some informal training sessions. So whether we can bring in, as part of other NHS training, some stuff about social media. So looking at the real technical reasons, how you do it, how you send a tweet, what's a retweet, what's a link, how do you bittle, all those things. Education, education, education. But then also looking at where are the problems and what are the issues and how can we confront them and get over them and work together with other parties. So there's a lot in the future that we hope to achieve.
That sounds wonderful. Now, I imagine with such an undertaking, working with an organization like the NHS does not come without its share of challenges. First, it's a very large organization, it's a government organization, and then you're dealing with the issue of health, which is of course, a very basic thing, but also a very private thing to a lot of people. So tell us a little bit about some of the challenges that you face and how you deal with them.
So one of the largest challenges is how do we use social media without breaching confidentiality rules and regulations when we're talking potentially about people's very private healthcare needs. And it's something that we've discussed a lot on NHSM, and it's up there on the Phosphorus blog. Time and again, people come back and will try and knock social media out of the comms toolbox because of the confidentiality issues. Now, of course, there are things around that, and I'm not advocating at all going around tweeting who you've just treated and what they've been treated for, but we shouldn't just throw social media out just because of this one concern. There are too many positives that we can get out of it, so there are ways to use social media without breaching people's confidentiality. It is just a conversation. The standard rule applies that if you don't want to say it in the supermarket or in the lift, then don't put it on social media. It's pretty simple. Now, hospitals do a lot without just treating people. They are informing people at the same time. There's a public health message to be got out. Also, quite importantly, they're providing a service to patients. So social media enables somebody to ask a hospital, where's this department? How do I ring the admissions for some physio? Where do I find this information? And the hospital is then able to give information in a timely and relevant manner. And that's very, very powerful. That's doing a lot for the person and doing a lot for the hospital because it's giving them the opportunity to provide a better service. So while confidentiality is definitely an issue we shouldn't be avoiding to talk about, we should just keep it in the context of the wider positive potential that social media holds.
Alex, what would be your top tip for anyone working in a healthcare situation, whether they are healthcare professionals themselves, whether they are healthcare bodies such as the NHS or hospitals, or communication consultants or other folks who work in the healthcare field? What would be the one thing that you would tell them about using social media to better their relationships with their stakeholders?
So for me, I think social media has to be integrated into the whole business, the whole service, be it healthcare or Mars bars, chocolate bars for the people in the US. It has to mirror what you're providing. So you cannot paint a perfect picture on social media and be chatty and really nice for that patient then to walk in and have a receptionist who is a complete and utter pain in the backside. Talk to them, be rude to them. So can you as a communications professional look down the line, look down the way that the patient comes into your building or into your service and say, right, is the persona we've developed online mirroring that of the service? And are we doing enough to ensure that what we want to provide online, a nice, friendly, approachable, helpful service, is actually what's given to this patient when they come in for the thing that they're talking to you about, their treatment or their needs or the needs of their parents or family and friends.
And that really goes back to some pretty core education and training, doesn't it?
Yes. There needs to be an understanding that social media isn't big and scary and only for firms to mess around with and do brilliant, awesome things such as Old Spice's stuff or the Mama IT campaign. There needs to be an understanding that there is a possibility here for the NHS and other healthcare providers to increase the service offer that they currently have for patients. And to do that, staff have to be on board. You have to get people to understand that internally. And that's one of the great battles that we're going through at the moment. And one of the challenges which I really, really enjoy is how do you make a doctor who's trained for 15 years to become a consultant, 20 years to become a consultant, understand how this new, really shiny object, if you like, can actually add value to his day-to-day. And once you crack that, really you are in a position to take full ownership of what social media can do for your service.
Alex, thanks so much. It's been really, really great to chat with you, and I'm looking forward to being posted with the continuing adventures of Alex Talbott and the NHS.
Thank you very much.
Thanks everyone for watching. This was Shonali Burke with Waxing and Lyrical.